Hi, my name is Julie, and today we're going to be talking about the documentary U.S. Healthcare, The Good News. Currently, healthcare in America, Americans in some places spend almost $17,000 annually for healthcare, which is really high to me. It varies wildly from town to town with different fees from private insurances, Medicare, and Medicaid. And even in some places, Medicaid patients often can't get seen for the fact that doctors just get paid less for seeing them. This documentary follows three places: Grand Junction, Colorado, Seattle, Washington, and Everett, Washington. These places show good examples of what healthcare should look like. It starts in Grand Junction, Colorado, where Dartmouth Institute for Health Policy calls them a model for healthcare. Starting with a same fee for the same treatment, they have an independent practice association, nonprofit clinics, digital record keeping that improves care and cost, a guaranteed scene for prenatal care, and their healthcare costs around a third than some places in America. Moving on to Seattle, Washington, it has a patient-centered medical home. A patient-centered medical home is just where doctors work around the patients instead of patients working around the doctors. All of their records they keep are electronic. They've increased time with patients up to 30 minutes. They have something called virtual medicine, which is just the ability to be able to email your doctor your questions and your concerns. And they really know how to treat people before they get ill. The third and final place is Everett, Washington. It is a facility that is completely owned by the doctors, and they really know how to control the cost of their health care, such as limiting the use of expensive procedures such as CAT scans by going through a certain amount of qualifications to be able to go and get these. They have case care managers to be able to help people who are really sick or have a lot of health problems or a lot of prescriptions. They can go through it and help them manage it a little bit better. And then they generally only prescribe generic prescription drugs, which can make a huge difference. I'm not saying that we have to do every single thing that these people do, because healthcare, of course, follows in our own area, but we can start with simple things to help be able to afford healthcare for the American people in our own area. What I'm proposing that we start with is the same fee from everyone. No matter what insurance you have, to be able to one set fee for every procedure. Moving away from paper records and going digital record keeping would not only help them keep healthcare costs down, it would help us keep healthcare costs down. Increasing our face-to-face time with patients to be able to accurately diagnose what the problem is, we need to spend more than 5-10 minutes with the patient. You cannot guarantee that you'll be able to know what's wrong with somebody in 5 or 10 minutes. Moving away from name brand drugs. Generic prescription drugs are the exact same thing as name brand drugs. Limiting the use of expensive procedures. Let's create our own set of qualifications before somebody can be able to get into the CAT scan, into any of our expensive procedures, to be able to know before they get in. To treat people before illness gets really expensive is an important step in making healthcare more affordable, because if you can treat them properly before things get out of control, then it will really make a difference in what you're seeing them pay. To be able to make healthcare affordable, we need to start innovating new ideas into what we should do in our own businesses and our own practices. So what I think we should do, the same fee from everyone. Digital record keeping, increasing face-to-face time with patients, generic prescription drugs, limiting the use of expensive procedures, and treating people before they get really ill. Thank you for taking the time to listen to me today, and I hope you have a wonderful day.